The current Ebola outbreak isn't just deadly, it's also spreading faster than any Ebola outbreak before it.
I think one thing that's different about this outbreak is the unprecedented speed. It's moving really, really fast. And I can't hide it from you, my feelings. Maybe expressing my feelings properly would be better. I'm deeply, deeply concerned by how the situation is on the ground.
The World Health Organization warns that the virus has gotten, quote, ahead of us. And they're worried not only because 2,000 people have died, they're also worried about the timing. According to the latest data from the Democratic Republic of the Congo, the first 1,000 people died over a period of 9 weeks. But then the death toll doubled in just the last 3 weeks. Why is it moving so fast, and can it be stopped? I'll be talking to Eileen Marty, infectious disease expert at Florida International University, who helped the WHO contain Ebola a decade ago in Nigeria and Equatorial Guinea. Eileen, good to see you.
Good to see you.
So why is this Ebola outbreak moving so fast?
It's about containment. It's not about the virus. It's not about its reproductive number. Actually, the estimated reproductive number for this particular Bundibugyo virus is only 1.74, which is completely manageable if we had a handle on actually being able to properly do the contact tracing. Right now, we're at best contact tracing about 12% of the people who are around a contact. Unless we have 70% containment of contact tracing, rather, we'll never get this thing under control properly. It's estimated, in fact, that right now, at this rate of only 12%, by 3 months, we're going to have 20,000 cases.
And that would make it the biggest ever outbreak of Ebola, if I'm right?
Absolutely. It's already the largest of Bundibugyo outbreaks. It's the third Bundibugyo outbreak we've ever had, and it would now exceed even that enormous outbreak that we had in West Africa that started in December 2013, and we had straggling cases all the way to 2016. So yeah, it would actually exceed that. And again, it's not a problem of the virus itself. Although that's partially it, because unlike Ebola Zaire viruses, we do not have a licensed vaccine that we can use. Moderna has produced a vaccine for Bundibugyo, and it's now undergoing early clinical trials. But that's not the same thing as having a really available, licensed and available vaccine to use. The biggest problem remains the problem of people who are in the involved areas of the DRC in particular, not having trust in the healthcare system and the healthcare workers and the way that they're being treated.
And why is that? And why is it so much worse in the DRC than in other places?
Right. Again, we're in a high conflict zone. We're in an area that has enormous amounts of riches in terms of mineral wealth of various kinds, including gold. And we have a longstanding conflict between tribes. And this conflict that's in the area leads to a lot of very difficult human behavior that is, for example, they've already put some of our treatment centers on fire, patients running out because they're being attacked or being gunned down. That's a huge part of the problem, and individuals being treated in locations that are not healthcare centers because they are afraid that the healthcare center is going to be attacked. That's dangerous. And that's making this thing spread further. Another big problem, and one of the reasons this is spreading so fast, is that some of the vast majority of the early cases were healthcare workers. And therefore, that has decreased the intellectual and training power to help contain this outbreak.
Eileen, I want to talk to you more in a second. Let's listen first to what WHO Africa Regional Director Mohamed Yacoub just said.
The situation of Ebola in 3 months now is not good. We are nearly 2,000 people have died. We have 4,000 people affected. We ask ourselves, where are they dying? And 60 to 70% are dying at home.
Eileen, he just said most of the people dying are dying at home. Why is that significant from a public health perspective?
Because at home, they are being cared for by individuals who are thus contacts. That's part of the reason. The other problem with dying at home is that at home, with home care, you're very unlikely to get the quality of care and the type of care that is needed for better survival. So it aggravates two different things. It increases the total number of people who get infected, and it also decreases the survival rate. In fact, we're seeing that in the DRC, that now the case fatality rate is over 40%. And at the beginning, it was much lower. And if you compare it to Uganda, the case fatality rate is about 14. And that is because when you have care in homes, especially impoverished homes, you're not going to be able to provide the hydration, which is one of the key things that we have to do for these patients, and other medications and treatment in general, supportive care that's necessary for their survival.
Weeks ago, there was a lot of talk about how this particular strain of the virus had a higher fatality rate. Are you saying that it doesn't have to do with the virus itself, but that it actually has to do with these conditions on the ground?
It is completely about the condition in the ground. Bundibugyo virus, which is a different species, not just a strain. It's not a strain of Zaire. It's a different species. It's as different as a potato and a tomato, right? It could be something could be the same genus in a different species and be quite different. So what you have to consider here is we're looking at a virus that in and of itself could be controlled, in and of itself could be treated and not have this high a case fatality rate. But without proper treatment, people being in facilities and being isolated, we're seeing very high case fatality rates in the 40%. And by the way, just to put that in perspective, Ebola Zaire has caused in some outbreaks 80 to 90% fatality rates. So that's actually a worse virus in and of itself. But again, it's not about the virus, although that's part of it. It's truly about human behavior and how we are or are not able to get our arms around what's going on out there.
So what has to happen for us to not get to the 30,000 cases you mentioned earlier?
Yeah, to not get to these outrageous numbers, we have to be able to isolate patients in the kinds of environment where they're not going to be contaminating other people, and we have to be able to treat them. That's another thing, by the way. When you treat them properly and promptly, even the treatment itself starts to decrease the risk that other people are going to get infected. So all of that has to be done. And WHO is asking for more funding. And it's not just funding for security, because obviously the biggest problem is the lack of security. You can't just bring in military-looking people, because in that area where that's going on, that's going to be counterproductive. These people are used to seeing people with guns, and they don't respond well to that, of course. Nobody really wants to respond well to that. What you need to do is bring in anthropologists. You need to bring in diplomats that can coordinate with these groups and get to the leaders of the infighting groups so that they can understand that to help themselves, they need to help us be able to go there and get our arms around the problem.
How effective are these warnings like the one that we're seeing from the WHO in moving the global community and health authorities toward practices that you're talking about?
Well, they should be excellent, but unfortunately, I think there's a little bit of pandemic fatigue syndrome going on here in the world, and I think people don't want to have to recognize that this is a potential problem for the entire world. It is nonetheless a public health emergency of international concern, and it does behoove all of us to pay attention, to help the WHO, and to do the type of security measures that are going to basically calm down the flames of what's going on physically between people, and then be able to do the types of using the experimental vaccine, using the methods that we know from epidemiology for isolation of contacts and, quarantining of contacts and isolation of patients, we can get this thing under control. So I'm very glad that you're asking these questions and that you're having this program, because we absolutely need to raise awareness. People need to realize that this is only going to get worse unless we take action soon.
Dr. Eileen Marty, thank you for your insights.
Pleasure. Thank you.
Thanks for watching this video. And if you haven't already, don't forget to subscribe to our channel. If you found this video useful, please give us a like.